Kentucky is one of 12 states that doesn't allow abortion except to save the life of the mother. Now, abortion advocates say that women in life-threatening pregnancy situations have been hurt or worse yet have died. To address any confusion, the Kentucky State Legislature recently passed a bill to define what abortion is, what it isn't, and the situations addressing serious pregnancy complications that could be life-threatening. I'm Richard Nelson, host of the Commonwealth Matters, and joining us to talk further is State Representative Nancy Tate, who was very involved with this piece of legislation. Representative Tate, welcome to the Commonwealth Matters.
Thank you so much, Richard. I appreciate the opportunity to speak with you and obviously with your listeners as well. Thank you.
Well, it's always good to have you on. You are no stranger to this program. We have talked about life issues in the past, and just to give the listeners who are tuning in some more background, you are a state representative from Meade County. You've worked in the business world for several years, I believe at UPS.
That's correct. Yes, sir.
But you're also a pro-life advocate. You've served on the Kentucky Right to Life Board at the state level for years, got elected to the state legislature a number of elections ago, and now you are the chairwoman of the Pro-Life Caucus. So we appreciate your leadership in that area.
Thank you so very much. It's quite an honor, obviously, to serve the people of Meade County and Hardin County, because I represent Hardin County as well. But just to serve as the Pro-Life Caucus chair has been just such an honor for me to be able to represent life and liberty for the Commonwealth of Kentucky.
And Representative Tate, you have shepherded and either co-sponsored or supported or shepherded a number of pro-life bills since you got elected to the state legislature. I think Kentucky is up to, just in the last 7 years, I think it's a dozen pro-life bills that have been enacted in law, and you're involved with very many of those. But I want us to talk about the trigger bill that passed in 2019, and it said that if Roe v. Wade is ever overturned, Kentucky will be a pro-life state, that abortion is banned, except to save the life of the mother. Now, since that happened in 2022 with the Dobbs ruling, it put the issue back to the states. At that time, I believe there were 14 states that had similar laws, trigger laws. Kentucky was one of them. But since then, Nancy, we have seen a number of health professionals, primarily pro-abortion healthcare professionals, say that the state's abortion ban is too medically vague and it inhibits their ability to properly treat miscarriages, hemorrhages, and other emergencies. Has that been the case? Was Kentucky's exception in our trigger law, was that enough to give healthcare professionals the green light to help women in crisis pregnancies or not?
Yeah, Richard, from my perspective, from a legislator's perspective, and then also from a patient's perspective, from my perspective, that was, enough. When we talk about the life of the mother, that's the only exception for our abortion laws. And our Attorney General Daniel Cameron, put out two statements that made it very clear from my perspective. I think one of the things that was interesting to me, though, was whenever Dr. Jeffrey Goldberg came to us and he, was representing Kentucky, ACOG of Kentucky. When he came to us and talked to us about this, our trigger law and about the laws that were in place in the Commonwealth of Kentucky, I tried to listen to him with a very open mind. And from a medical practitioner's perspective, I still don't agree. I still didn't agree that that language was too vague, but I was very willing to listen to what his changes were, what the modifications were that he suggested, and that whenever I heard those modifications, there wasn't anything that I saw that would limit our ability to protect the baby in the womb. And I think that that gave me the opportunity to be accommodating, and then because my primary goal obviously was to protect the baby in the womb and the mother as well, but to make sure that we were not opening up the avenue for elective abortions.
Sure. Now, House Bill 90, this piece of legislation that defines what abortion is, what it isn't, and then it talks about reasonable medical judgment of healthcare professionals. It gives, I think it's 8 or 9 situations that say the removal of a failed or life-threatening pregnancy is allowed under state law, and it includes things like this: ectopic pregnancy, molar pregnancy, sepsis treatment, hemorrhage control, and management, and that's the term that's used, management of fetal demise and stillbirth, and then other life-threatening situations. So it spells out in black and white what is not considered abortion. And these are some of the maybe the prevalent life-threatening situations for a pregnant woman. And that's what you spelled out in law. Now, Nancy, it's my understanding that there have been couple of states cases that made their way to the state Supreme Court. The court dismissed them, but one of the sitting state Supreme Court justices said that there's confusion. We don't know what's allowed. And how we read that was she was signaling to the legislature, define what is allowed, put it in Kentucky statutes. What are these medical situations that doctors can intervene when it comes to pregnancy? Is that a fair assessment, or is that your understanding as well?
That was certainly my understanding. And one of the things that I was willing to understand and willing to, I'll use the word compromise, willing to accommodate, I think that's probably a better word, is that I think we had it very well defined what an abortion was, but we did not have it defined clearly what an abortion wasn't. And so while the language that we passed, in this General Assembly in this session this year is not intended to be prescriptive, it is intended to give more guidance, to give more opportunity and more guidance. I'll just stick with that term for the doctors in order for them to better understand what we're talking about. I think the other part that was so important was that we changed the good faith clinical judgment to reasonable medical judgment. And to me, as a legislator and as a patient, to you know, reasonable medical judgment is a term that's commonly used in the medical world. And so that has a very strong definition into what that means. And as you've said before, the Supreme Court of Texas has actually used this terminology and said that the reasonable medical judgment, those words are so much more descriptive in the medical community than good faith clinical judgment.
So if I could press in, and I'm not an attorney, but is reasonable medical judgment, is that a term that has more latitude for a medical professional? Because I've heard argue. So, for example, we've heard OB-GYNs in Kentucky say this doesn't help. It binds the hands of doctors who are dealing with a crisis pregnancy or an emergency pregnancy situation. So here's what Janet Weigel, a retired Louisville OB-GYN, said, that the ambiguity of the trigger law forced doctors to delay treatment in order to first consult with lawyers and colleagues. She was reported in the Kentucky Lantern as saying that. Was that true? Were there actually doctors in the living room saying, wait, I've got to call my attorney to see if this is if we can provide hemorrhage management or deal with this ectopic pregnancy, or was this pro-abortion hyperbole? What was going on here?
Yeah, from my perspective, it's pro-abortion hyperbole. They're looking for the opportunity for elective abortions, and as a pro-life caucus, we're just not going to do that. For me, as a patient, and then as the mother of, my daughter's having children, she's got her, up to her fifth child, and soon I'll see my grandchildren, in the future. So as a patient, from a medical perspective, I'm very disappointed whenever I hear a doctor saying that they don't know what good medical judgment is. They use that. The doctors use their, their good medical judgment, reasonable medical judgment on a daily basis. I mean, they're educated, right? First of all, they're educated. Then obviously they've been out in the medical practice, and then they do have their colleagues. But if I hear a doctor saying that they don't know when they're supposed to treat sepsis, That's concerning to me. When they don't know when to treat hemorrhaging, that's concerning to me because from my perspective as a doctor, those are some of the basic um, conditions that I expect the doctors to be prepared to practice on. Good, reasonable medical judgment, as it says in House Bill 90, and actually, if you just pull up the definition, means the range of conclusions or recommendations that licensed medical practitioners with similarly sufficient training and expertise may communicate to a patient based upon current available medical evidence. And so that makes the assumption, or actually spells it out in law, that we're aware that medical evidence and that training and that the understanding will potentially change because with technology, obviously our knowledge increases on pretty much a daily basis.
Yeah, that's good. Another doctor here in Kentucky wrote a column explaining her suffering from a miscarriage. She was hospitalized with sepsis after being unable to fill a prescription in a Lexington pharmacy for a drug used to treat miscarriage. And this is what she said in her column. And this is Dr. Jessica Atkins Murphy. She wrote this in the Kentucky Lantern. I did not get adequate miscarriage care because of this culture of fear that's been created and because of unnecessary regulations that made it harder to get. And this is not how we should be practicing medicine for miscarriage in this century. Now, she was told that the mifepristone that was prescribed to her wasn't available at the pharmacy. The doctor, there was some kind of an issue there, but so mifepristone is often used in procuring an abortion. It's not available over the counter. I guess my question is were there alternative drugs, or would there have been a workaround in her situation to address this miscarriage she was having?
Well, Richard, I think I've shared this with the General Assembly and shared it with the public at large, but that I've had 3 miscarriages myself. And so, my doctor didn't wait for me to get a prescription filled at the pharmacy. My doctor immediately, once we determined through the ultrasound that my babies were actually dead, then we went and did the DNC. And so the DNC is a quite common practice for utilization whenever you have a miscarriage. And so, from my perspective, if her doctor or was waiting for a prescription to be filled, I think that there were workarounds and that there were certainly other avenues and other opportunities to use.
I'm going to go back to Janet Weil, and I appreciate you bearing with some of these tough questions, but I think it's important that these questions are answered. This is a serious public policy that's going to. It was recently vetoed. Well, let me take a step back here. It may be vetoed by the governor. We don't know.
Possibly. Up to this point, he has not vetoed it yet. That's correct. Today's his last day for the veto opportunity.
And quite frankly, I'm expecting a veto. I'm not optimistic. Looking at some of how he's communicating on this issue and the affinity groups that support the governor who are really calling for a veto, I'm not very optimistic. But it is important that we address the objections and some of the challenges to bring clarity to this issue. Maybe cut through some of the fluff and the smoke that's there. And that's why we have you on. So I appreciate you being on the hot seat. So Janet Weigel, again, a retired Louisville OB-GYN, referred to this law. She said this: we have cared for enough patients over the years that we know what the likely outcome will be in certain situations. Without the abortion ban, we would intervene well before we thought her life was at risk. We would not wait, absolutely not wait, until the mother was in any kind of threat or permanent illness, permanent destruction of her gynecologic capabilities, or obstetrical capabilities. How do you respond to that? She's saying that the term life-threatening handcuffs doctors who wouldn't wait until a woman was in a life-threatening situation.
Again, Richard, it just seems like to me that what she's looking for is elective abortions. And I think that, what she actually said was that reasonable medical judgment. From my perspective, she just described reasonable medical judgment. There are case studies, there are practices, you know, there, women have babies every single day. And so, there is best cases, best practices, best understanding, that's reasonable medical judgment. And so, I think it's so very important for these doctors to understand that, and I think most OBGYNs actually do, they understand that there are two patients. It's the mother and the baby. And that's exactly what this legislation is saying, is that everyone in the medical community needs to continue to treat pregnant women and their babies as two patients, and that they need to continue to try to save the life of both babies. And if there's a separation, if there's a um, purposeful separation, then that purposeful separation needs to be to protect both lives, the mother and the baby.
There's a proverb that says, when a land transgresses, it has many rulers, but with a man of understanding and knowledge, its stability will long continue. The idea here is that when people live without regard to their neighbors and without moral boundaries, then you need more government to restrain people who've gone off the rails. So if people are going to flourish, God's truth must be embraced. After all, God tells us who we are, what's our purpose, and how to live in harmony with our fellow man. Christians should understand what God's Word says and how to think biblically about the issues so that they can engage well. To stay up to date with what's going on in Kentucky, subscribe to CPC's newsletter. Go to CommonwealthPolicyCenter.org to subscribe, and you can also find other resources there. Thank you, and may God bless you. If you're just joining us, you're tuned in to the Commonwealth Matters. I'm your host, Richard Nelson, here with State Representative Nancy Tate. And we're talking about House Bill 90, the bill that defines what abortion is, what it isn't, and also empowers healthcare professionals to use reasonable medical judgment when it comes to assisting women in life-threatening pregnancy situations. Representative Tate, I had the chance to watch a KET, Kentucky Tonight, program where State Right to Life Director Adia Wushner debated Tamara Weeder of Kentucky Planned Parenthood. And it was a fascinating conversation. But Tamara Weeder said that this terminology in this bill, House Bill 90, in the redefinition of abortion, I quote, mirrors language used by anti-abortion extremist groups. Do you have any idea what she's talking about?
I really don't. I've had somebody else ask me that, and their question is that, this language is typically used by anti-abortion. You can use the word extremist, but anti-abortioners. And I said, then make no mistake about it. The legislative branch in the Commonwealth of Kentucky is anti-abortion. We truly are an anti-abortion. The majority party is anti-abortion. But what we are is that we're pro-life. We're pro-life for the mother and the baby. We love them both, the mother and the baby, and that our objective is to save the lives of both the mother and the baby. So, for me to be accused of being anti-abortion, to me that's a badge of honor that I'm glad to wear. I'm proud to wear that because I am anti-abortion. But from my perspective, that's terminology that is kind of owed here in Kentucky, because our trigger law actually said that. It said that we are anti-abortion. Now what we need to do is we need to move forward into being pro-life. Last year we passed the Omnibus bill, which I'm so proud of being part of the Omnibus bill. And from my perspective, this House Bill 90 is actually Omnibus 2, or sometimes people say Omnibus 3, but that's exactly what the intent of the majority caucus in Kentucky is, to love them both, the mother and the baby, and to preserve both lives, unless that is absolutely impossible to do, and that's to preserve the life of the mother.
That's good. What I'm hearing from you, Representative Tate, is that this legislation is it's pro-woman, it's pro-healthcare, It's pro-clarity when it comes to medical help for women in crisis pregnancies situations. It's the opposite of what we're hearing pro-abortion advocates say. How do you address the charges that in this bill they're using non-medical terminology? I've seen this come up over and over. It's non-medical, it's non-scientific. How do you address that?
Yeah, I say again, I think that this language is not intended to be prescriptive. If there needs to be clarity, I think that it was so great that Dr. Jeffrey Goldberg came to us to help us with this legislation to make sure that there were some clarifications. And I appreciate him. He's actually retired once, if not more than once, and he understands. He's one of those pro-life OGBYNs, and he's representing ACOG of Kentucky. So, we've also heard, well, National ACOG doesn't support this legislation. We're more concerned about ACOG of Kentucky, and we're more concerned about, him coming to us and asking for that clarification. One of the things that whenever he testified, he said that, when we initially started the conversations, there was a lot of wariness and distrust. And I can tell you that from my perspective, there still will be. Every time that we work with ACOG, there will be wariness and distrust because we're kind of looking at it from two totally different perspectives. National ACOG, unfortunately, has come to the perspective of being pro-choice. But the majority caucus in Kentucky, again, we just want to continue to emphasize that we are a pro-life caucus, and we're willing to consider clarification in our language as long as it does not move us down the slippery slope of being pro pro-choice. And so what we'll do is we actually will pass this legislation, and then we'll continue to listen to the medical community, the pro-life medical community, and we'll continue to listen to the judicial branch as well. As you know, and our listeners know, that there's three separate branches of government: the executive, judicial, and the legislative branch. And we'll listen to the judicial branch because we appreciate that feedback. Just like the reasonable medical judgment came from a Supreme Court ruling in Texas in 2023. So we're continue to watch and be, I'll say, to be alert, because we want to make sure that we continue to emphasize our pro-life, our dedication to pro-life and the life and the life of both the mother and the baby.
Yeah, and Nancy, I appreciate your pro-life dedication, your commitment, the hard work you and the Republican caucus, but your leadership on the House Pro-Life Caucus has made a huge difference in the Commonwealth. We, again, are one of 12 states that has a total ban on abortion except to save the life of the mother. This measure, House Bill 90, just clarifies what abortion is and what it isn't. And I think heads off another challenge, or at least it takes away an argument from the pro-abortion left as to why they should overturn the whole abortion ban. And that's why I suspect they are grasping. And if I could just put it this way, making stuff up. And I'm going to give an example. I'll go back to Tamara Weeder of Planned Parenthood. She said this in an interview with the Kentucky Lantern: adding the terms life-saving and life-threatening to its provisions regarding miscarriage management, sepsis, and hemorrhages actually could make doctors wait longer to provide an abortion in those circumstances. Here's why. And then she goes on to say, this enshrines the delay. Here's why I bring that up. You'd mentioned Dr. Jeffrey Goldberg, the legislative advocacy chair for Kentucky's chapter of ACOG. He said this in committee: the goal of the bill is to prevent women from having their care delayed while they bleed out. So you have one statement from a pro-abortion activist, then you have a statement from a doctor testifying in committee saying, here's why we need this bill. And that's why we're having this conversation. We're trying to bring light into this darkness, trying to cut through the spin and really the deception that's there. And I will have no pretense of being unbiased when it comes to the life. I am pro-life. The Commonwealth Policy Center is pro-life. We're dedicated to working for a culture of life, as you are. But it's so important that we expose the lies and the misinformation that's out there. So here's our pivot to. Have you found it difficult to navigate in work for a pro-life message when there's so much disinformation and lies and misrepresentation, especially when you have often a news media that's not fair in treating your side and my side for that matter?
Yeah, Richard, I love that question. And and I want to go back to your statement about what Tamara actually keeps saying. I want to just point out that Tamara actually works for Planned Parenthood. And as we know, Planned Parenthood is a multi-billion-dollar organization. And so what she's actually fighting for is she's fighting for their business's right to kill our children. And I can't go along with that. So do I find it difficult to navigate and to operate in such a pro choice environment? And the answer is no, Richard. And the reason why is, I actually started in the pro life community whenever I was 25 years old. And so, I've had the opportunity and I say that lovingly because I had the opportunity to have the miscarriages. I've had the opportunity to have complications. I've had the opportunity to have less than perfect pregnancies and outcomes. And and while I don't wish that on anybody, it's also given me the opportunity to see how I've had excellent health care here in the Commonwealth of Kentucky. And what I'm really I'm a by nature, by working for UPS, one of the things that I did was that I was a problem solver. And what I'm saying is that potentially the language in House Bill 90 will potentially uh, become the best case and the best example, the best practices that we'll see being used across the nation. And I think that that's another reason why people like Tamara are having a hard time with this, is because as we see people become more educated about the life and the life of the baby in the womb, that it's not just a lump of cells, it's actually a baby, and we can hear the heartbeat and see the heartbeat after 18 days of conception. So as we continue to communicate and the beautiful development of the baby in the womb, then that actually will see their business. We'll see their business of killing our babies in the womb. We'll see that start to minimize. And Tamara's job is to protect her company and to protect their ability to kill the baby in the womb. And I do not at all have a problem navigating and working through that type of environment, because I'm quite passionate and quite confident that I'm on the right side.
Yeah, I agree. Nancy Tate, thank you so much for joining us on the Commonwealth Matters, and thank you for restoring a culture of life to the Commonwealth of Kentucky.
Thank you so much, Richard Nelson and Commonwealth Policy Center. Thank you.